Well, we'll just go ahead and get started. I'm sure some other people will get on because we know everybody, your time is important. So thank you all for joining us tonight. And we are excited because this is going to be a story. I think it's just going to carry us through the next 30 minutes. So I'll raise my glass of water at this moment to everybody for staying on. You'll notice there's a chat room box on the bottom. Please feel free to just shoot us a question, a comment, whatever you'd like to, you know, a WTH, if there was something like, what the heck just happened to WebEx, something like that, that would be great. But Dave and I are excited to share with you what we've got tonight, and it's going to be basically hygiene focused. So, David, you want to tell them a little bit about what in the world is tag team dentistry?
Sure, I'd be happy to. So, hang on one second. Tag team dentistry, you know what? Apparently it's not going to let me change the slide either. Oh, there we go. My goodness. So I'll give you guys a real quick brief story myself. You know, Anastasia and I got together, and we've been talking back and forth about some of the issues that dentists and the hygienists have together in practice day to day. And we found, gosh, we weren't the only ones. We went out and did a little research to see what dentists and hygienists and practices are experiencing around the country. So my story in a nutshell, real briefly, I've been a practicing dentist for 20 years now. I bought a practice about 14 years ago in what is proudly the third poorest city in America, Buffalo, New York. I have one partner there. We have an associate. And I don't tell you this for any other reason than to, I guess, give you a little expose that a lot of the principles that Anastasia and I are going to touch upon tonight, and hopefully if you'll join us in the future, we'll touch more in the future, are very valid and they work anywhere. Big city, small city, doesn't make a bit of difference. But when I purchased my practice, we started out at about $600,000 a year. And as we stand, we finished up 2013 at $3.1 million. So we're really excited to share perspective that comes from both a dentist and a hygienist standpoint, and we know these principles will work well for all of you. So I'm going to turn it over to you, my boss lady.
Well, my name is Anastasia Torchetta. I've been a practicing dental hygienist for 25 years. I went through assisting first and really enjoyed the patient care. After passing out a couple of times, I was encouraged to probably go into hygiene where there wasn't as much, let's just say, surgery and other fun things that would make a fellow germaphobe pass out, quite embarrassing. But then my passion after Linda Miles came into an office encouraged me to take my energy and basically share that in how we can make a difference for our patients, which ultimately leads to making a difference in our bottom line. Thanks to social media, that's totally helped me out in marketing and doing video blogs, but also becoming, basically closing the gap between the consumer and the professional. So we teamed up and taking our experience, hopefully we will help you out tonight. And again, we welcome any questions, but maybe seeing how we both work in different states, and obviously we don't work together, I think that's a really unique combination to give everybody something to take away tonight.
Absolutely, totally agree with you. One of my favorite pictures, Anastasia, how about you?
Do it every single day, it seems like, in a dental office. What do you think?
Yeah, absolutely. I'll tell you what, it's the elephant in the room that we deal with all the time, and some of us talk out loud about it, and sometimes we just walk in the next room hoping that elephant doesn't follow us. But there are some definite pet peeves that we as dentists have, and I am quite sure that Anastasia would share those as a hygienist, that we really need to address and almost get past before we can make significant changes for success in our practices.
Oh, definitely. And, you know, I always find it interesting because there are some things, like when we sat down and we would say, this really bothers me about you. So, for example, let's just go there and talk about the two things that we'll talk about tonight, and that's going to be time management. And then we're also going to talk a little bit about case presentation, but I think really the big one tonight may, in fact, be time management. I mean, how many times do I come in to get the doctor to come in? Or, you know, try to stay on time. What if a patient's late? Anything like that. I know these things never go away, but I got to tell you, there's got to be something different because I'm impeding on your time, and then you're also just, doing the same thing to me.
That might happen from time to time. We feel the same way on the other end of the stick. Sometimes we walk into a room and we're trying to figure out how 30 minutes turn into 45 and 45 turn into an hour. We're trying to figure out how things that we've discussed maybe didn't happen and maybe questioning why they didn't happen. We're just trying to put everything together, really, and try and make sense of what's going on. So I think what we know is no matter where we are in the country and what office we're in, there's three very critical factors that we need to talk about for time management.
I agree with that. So let's just tackle the first elephant in the room, and that is adequate amount of appointment time. So I'm going to ask everybody in the chat box, you can see there's a, you can send to everyone or you can send to David. If you could please click everyone, and we're just going to go and ask some questions after this, and that way you're already prepared ahead of time. But adequate appointment time, I think that is so critical because there's a couple of offices I work in where I may get 45 minutes, but everybody, y'all know that it is not 45 minutes that I get with that patient till I set up the room, tear down the room, do a health history, take blood pressure. Now the health history is super uber fast, which means I'm probably missing something, let alone hand scaling. I call it kind of like the smile zone, but you have to know what the doctor expects of you in that practice. So adequate appointment time may be 60 minutes. And even sometimes if you're adding different services, depending what's expected of you, that is where I think you grant more time. Because if you have more time, as a hygienist, you should produce more during that time. What do you think, David?
Absolutely. So, I think one of the most important things that we can talk about for adequate appointment time are, what systems we have in our offices, and whether it's one hygienist, two, or three, do we have a process? And one of the things I always think about at McDonald's is, what makes them so successful on an international level? Is it really that they make the best burger out there? I don't really think so. I think probably it's that it's consistent. No matter where you go, no matter what country you're in, you know what to expect. And those
Starbucks,
systems,
David, just like Starbucks.
Just like Starbucks.
Now, a McDonald's burger, I'm not feeling it. If it's Starbucks, I'm in.
You're down with that?
Yes.
Yeah.
Definitely. But
so
yeah,
the question really
is,
one of the things we need to systematize is what happens in that hour's time. How long does that take? What's the process? What's the sequence? How does that appointment time lay out?
For the hygienist to the doctor, what if we just sat down and said, what's expected of me during this appointment?
That's important. What is the vision, the mission of the practice? You mentioned to me one day that your hand sometimes gets tied in an office because my vision might be different than your vision, and how as a hygienist do you deal with that?
Exactly. So maybe something to do when you're looking at adequate appointment time, what all is expected of the hygienist to perform within that time. So seriously, just take a piece of paper and write things down from, okay, I'm bringing the patient back. So obviously, let's just pretend you've already got the patient in care. Step one would be a health history. How deep are you going to go with that health history? Are you going to ask more questions than the simple, and I've done it, I'll probably do it even more in certain offices that I work in, but I'll just say any changes, any allergies, any, have you been in the hospital in the last 6 months, any medication changes, and, are you taking any herbals, anything different like that? And most people will say no, and of course, we all know what happens. You come in and all of a sudden they're like, hey, guess what? I had a double hip replacement, and I did had another knee replacement, and I broke my ankle and had a lobotomy all 2 weeks ago. And I just wonder about that, that can take up a few minutes of time. So what else is expected? Do you expect blood pressure? Do you expect periodontal charting? Do you expect fluoride varnish? If you're doing fluoride varnish, that's going to take time. Not a lot of time, but do I do it at the end or do I do it at the beginning? Well, I can't do it at the beginning, so you're kind of stuck at the end. So you have to make sure that everybody's staying on time. And I think the first 60 minutes is really going to be, it should be the standard. If not, thinking about extending it a few more minutes, you know, on maybe an hour and 15.
You know what? We've always talked to our hygienists because we ask for a lot. You know, every time I walk into a room, I think it's really important for us to have intraoral camera pictures up. That's critical. We need to understand what matters most to our patient. So understanding our human behavior element, so we know what drives the patient to say yes or no to treatment, is very critical. It's not so much about the 60 minutes per se as it is how do we maximize whatever time that is. So 60 minutes, I agree with you, is a wonderful minimum standard, but sometimes you need a little bit more, and it's the dollar amount has to be tagged to the treatment that's being delivered. And the deeper we go, the more we have to ask a patient for investment, and we've got great systems to get patients on board to say yes to that.
Well, that is a great segue to lead us into the second one, which is advocacy patient. If you're going to talk about adequate appointment time, it's a great way to see, okay, who is the patient advocate? And in saying that, so if we're going to do varnish, if we're going to do whiten, if we're going to do discuss bruxism and introduce something like that into the practice, we're going to talk about headaches and introduce a system like that into the practice. This is being an advocate for the patient, and that does take time, which obviously dovetails into our case presentation, but it's super important to see, do you even know what's in your practice? Because if you're first hired, a lot of us think, oh, well, this is the same old, same old. And you know what's great about dentistry is it's not. It just depends on where you work and what's expected of you.
100%. And Anastasia, you know, I'm not sure what all your thoughts on this are, but I think, you know, I've been a huge believer of the KISS principle my whole life. So for me, how we systematize is we always like to look at things as a yes or a no. You know, when a patient comes and sits in the chair, we go through a medical history. Do we have it? Yes. No. We go through an oral cancer screening. Are we under control? Yes or no. Periodontally, are we a healthy patient? Are we an unhealthy patient? Yes or no. Occlusally, you know, TMJ, muscles, et cetera, et cetera. Am I looking at my patient's teeth and the color of the chestnut wood trim in my office? Do they need a whitening? Yes or no? You know, are their restorations 30 years old? Yes or no? And I totally understand on the dentist side of things that you don't always have time to hit all those areas. The question is, can we create a very simple checklist so consistently, time in and time out, you know where to go, you know what the progression is, and we can flow.
Right. And wouldn't it be awesome if we want to, because you know how I feel about, and being an advocate for the patient is to not call the hygiene appointment a cleaning. So, I mean, I would encourage anybody on the call, if you're still doing that, in order for the hygienist to look at it different for their patients and start, I guess, to train them, if you will, for the vocabulary, is pick something, whether it be health and wellness, preventative, anything but, oh, we're going to, you know, pre-appoint you for your cleaning. Are you calling for your cleaning? It just makes me feel like I should just, you know, get my Swiffer out or something.
Well, it undervalues it. And a lot of times, I mean, you ask any patient, we've all done this. Everybody who's on this webinar tonight has had this thought in their head. Why is it that, especially our female patients, would never miss an appointment with their hairdresser? They value that time. It's very important. We need to add that value to what we do day in and day out because it's important.
Don't be messing with that, man. That is very valuable to us. I mean, it's high maintenance stuff, but it's just got to be done.
I understand.
It's just like, you know, I agree with you with the hygiene factor. If you think about you guys in Monday Night Football, I mean, hey, to some of us, that's hair maintenance, and it's just as important. You don't miss, right? You just don't miss, unless you're a sports fan. So in taking that to advocacy for the patient, what I find interesting when you said about hair maintenance, if you're talking about adding more into the appointment, some of us online might be even more cosmetically driven. Now, they're starting to sell more products that actually could be skincare products, oral health rinse products, different things like that. That's another thing to think about when you're addressing with your hygienist, okay, what are we going to do in this hour?
Absolutely. Because at the end of the day, I think what most practices are looking for is, number one, are we addressing our patients' needs? And do we have time to do that? And are we successful from a practice standpoint in doing that? If you're not, that's what we need to get you up to speed with first. But if you are, if you're nailing everything on a day-to-day basis, then the next question is, how do we address our patients' wants? How do we make that happen?
Exactly. And then that goes to the third point, which is accountability. So who is going to be accountable?
And I think that's the premise of everything we're talking about. We all have to hold accountability. And you know what? Thanks to Mark. That's a wonderful comment he's just made, that for any treatment recommended by the dentist, the hygienist is 6 times more likely to be able to close that in a secondary appointment due to that hour time frame. It's so true.
That's perfect, Mark. Thank you.
Yeah, we have to have the time in order to make it happen. And it's unfair of myself to ask you, Anastasia, to get everything done in 30 minutes.
Well, even my nails, because that's what people think we do, is we just sit in a chair and look around doing our nails or polishing our tiaras, right? And that's really not fair when you look at a higher end practice. And I don't mean like you have to have every single thing under the sun that's available to us, but I believe if high end is helping that patient's current state of oral health becoming healthier, because it's all about systemic health. And you know what? The bonus is we get to look good when you feel good. That will show also. But accountability, I believe that should actually be talked about. I don't hear that a lot, David. I know when I go into an office where I'm supposed to, you can do your work, whether it be hand instrumentation or ultrasonic instrumentation, whatever the case may be. What I find interesting is the rate of accountability varies. So in order for hygienists and dentists, again, start that conversation, who will be held accountable to find something new? Like how many people are using fluoride foams versus varnishes? How many people are, in the hygiene department, do they have a list maybe for the patient to understand the importance of a health and wellness visit? Wouldn't that be cool for a patient to walk away with?
Absolutely.
And include their blood pressure. That would be cool too. I'll bet you we can make a PDF for those who attended tonight, just like a little checklist for them, just to give them an idea using their own office.
100%. And I can tell you, statistically, time and time again, what we see, study after study, is that in a patient's mind, one of the top 3 things they would like from us is that we truly understand that oral systemic link. And we can talk about it all day long, but walking the talk is very different. If you want to claim that you're going to treat your patient periodontally because you understand that cardiovascularly there's a connection, diabetically there's a connection, Alzheimer's there's a connection, if we're not taking blood pressures, if we're not examining their medical history and really digging deep, if we're not having conversation with people's physicians and really bringing that together, are we really an advocate for their care and not accountable for our actions, or are we more, showing ourselves off to the community?
Exactly. So I guess to wrap it up, it would be more of what are you going to do? I mean, do you have, when you said you have the intraoral camera, sometimes because I work in Peeves, they do. But you made such a valid point, because I find I'm guilty of this, where I'll see a patient and I have what they need up on the screen for the doctor to come in, but once the treatment has been performed, and let's say their current state of oral health has maintained a healthy state, I don't take another picture. And if I can take a picture of somebody's unhealthy environment, wouldn't it be nice for them and myself to say, hey, Dr. Rice, check this out. It's healthy. This is what we got in 2014. And kind of celebrate it with that patient. That would be really cool.
Well, you're going to get more bees with honey, right? Isn't that the phrase?
I think so.
Yeah. Patients need to understand, they need to be rewarded and patted on the back for all the things that are going well. And I know when we break out our 6 intraoral camera shots, part of the mission for those photos is to find things that are going well in the patient's mouth as much as it is to find things that are going badly.
True. So if you're looking at that, you got intraoral, caries detection, oral cancer, perio-occlusal, TMJ, blending, and I mean really blending the medical with the dental, so with diabetes and cardiovascular disease, that can add up some time. So basically to just move that along, 60 minutes would be the, the recommended, but depending on what needs done, you can always add. And I would add in 15-minute increments, only because people may show up late or they may not show up late. Advocacy, I believe that comes with the services. And then just to bring it on home, I'd say we're both accountable because we're both leaders.
Absolutely. Everybody in the practice has an opportunity to be a leader. And I think that's very important. Sometimes, I don't know if you've ever heard this story before, but if you have you have a pack of geese flying through the air, sometimes the most difficult goose to be is the one in front. The rest of the pack is looking to the leader, but the leader's got nothing but blue sky in front of them. So we all have to be leaders. We all have to rely upon one another and support one another. That's
true. So I'm curious, everybody. It's going to be a yes or no question, so just type that in. Time to wake you all up. Now, how many of you have 60-minute appointments? Just put a Y or an N, and then just throw it on in the chat room. Do you have 60 minutes? Yay, we have a 60-minute one. I know. I can't believe I do 45 minutes. It's just really ridiculous sometimes when you're flying around like a crazy woman that we all are. Sweet. Now, as far as patient advocacy, have you had the conversation with the dentist, or has the dentist had it with you, yes or no, regarding maybe we can add services into hygiene, or let's talk about what we can do? Yes, no? I see one yes. No. Okay, we got that. Yeah, that makes a difference in how adequate the time is for actually what you would like to do and what you can bring to the table. So that might be encouraging to that attendee to just, I guess the main thing would be to say, look, there's some really cool stuff going out here, but you have to also, like David said, back it up with productivity. So I don't know anybody that wouldn't, be a patient advocate and then see the bottom line too.
Yeah, it has to work both ways. But Anastasia, you kind of alluded to a really important point that I'll try not to overemphasize is expectation. What as a dentist do I expect from my hygiene team? And as far as the hygienists go, do you truly understand the expectation of the practice? Because that's really where it all begins. If we get all on the same page together, we can accomplish something. But if you go in to play the game and you don't know the rules or how to win, then how can we ever expect our patients to get great results?
True. And we all want to work for you. Or somebody with your mindset. Because we work according to your leadership. So
I appreciate that.
I'm being serious. It would be a delight. It would be so refreshing. All right. So the case presentation, it obviously starts with communication. And probably one of the most frustrating things is not starting that. This may be difficult for some people to believe that I was not comfortable in case presenting. And I really thank Dr. Richmond from Edenton, North Carolina, who took me aside and really invested some time in me to start the conversation with my patients. Probably the big thing with communication is to make sure we're saying the same thing. I don't care what it is, but it has to be the same thing.
So you're saying I need to back you up?
You need to back us up, yes. And we need to back you up. So, I mean, it goes both ways, where if I start with somebody and say it's a periodontal charting, then throughout the whole office, we've got to say it's a periodontal charting. We don't just say, hey, your gums got charted, or, oh, this is a way to measure. Because to a patient, that's like, huh? I mean, that's like speaking, 5 different languages without Rosetta, right? So they don't really get it. So when you're looking at that, this is, it's one of the areas, thank you, Mark, and MJ. I like that. I just like MJ. Okay. So it's very important to say the same thing. And I'm noticing that even more, like, and Mark, just, to throw this your way, is with varnish. People are not understanding why we're switching. And when I temp, it makes it very different. When you do have a full-time hygienist, there's a difference. and why does everybody get it? So you have to look at something like that and talk about that language. What is varnish versus foam? Why are people getting it versus not? If a patient calls up and they're asking a question, our office administrative team needs to answer that question. And I'll bet a lot of the time they don't know because they don't know.
Absolutely. So we walk this world all day, every day. It's common for us. And what's fascinating, too, is sometimes you think you have a great office and you expect somebody to come in and think everything's going to be wonderful because maybe they came from an office who wasn't quite up to speed like you are. But every patient experience is based on their expectation from the past, right? That's all that they have to deal with. So we have to develop a new set of expectations. We have to be able to orient our patients to what we're going to do, how we're going to do it, and we all have to be on the same page. And yes, I love that, Mark. Styles and generations are huge. DISC is a wonderful, wonderful tool to bring to the practice when you start talking about conversation with patients, because we can do some things that are stellar and bring us a lot of success universally for all patients. You know, one of the simplest things is my favorite three-letter word is, instead of telling people things, just ask. You know, ask them questions, because we can keep ourselves from being boxed in the corner. But we could take it to a whole new level, and you understand different behavioral styles, you understand different generations and how people think and how they make decisions and how they make choices. We can really, really dial in and have amazing
follow-ups
conversations.
could do that too, you know?
Absolutely.
I mean, if you're looking at generational styles, I mean, asking a question to a younger Gen X, Gen Y, I wouldn't ask it, I would text it.
Absolutely.
You know, I mean, if you're looking at it from that way, that's their communication.
Absolutely. We had that conversation at the Yankee Dental. I believe somebody texted that question too while you were speaking.
Exactly. And, you know, I mean, and so in knowing your case presentation, to start the conversation, then maybe how do you start it with that particular person's personality? And what products do you expect me to know? So, like, I don't know your practice, but I don't know what's going on in restorative. So what do you have to offer? You know, I mean, like for Ivoclar or something like that, where you make a specific crown or a veneer, educating the team would be stellar. So we know, because otherwise, again, how, you know, it's kind of like if it gets lost between the office administrators to us, it's going to get lost in the middle too. So I need to know what you're doing so I can help you.
Absolutely. And when we have the ability to link our products and services to each patient based on their style, because some people are going to walk in and what are they going to care about? They're going to care about money. They're going to care about their appearance, time, trust, health, comfort. When we can nail what matters most to each individual patient and then tie that product, that service to their individual style, to what matters most to them, now we can really start having great conversations and hearing yes a whole lot more.
Love it. And knowing those products is also part of a supportive environment, meaning, you know, how many times it's like you've expected me to do something and I talked to the patient and they were late and then I didn't case present. That's pretty frustrating to you, I'm sure. As it is for me if I do tee it up and I'm like, and I've teed it up and it didn't go anywhere. Right?
You know
That's
what?
a little deflating.
That's a tremendous point, Nancy. That, you know, one of the things that you and I've talked about an awful lot is, you know, on your end, what I'm hoping happens is you can eliminate some of those limiting terms and some of that tech talk. And there are times I walk into a room and a conversation is, well, maybe we might want to take a look at that little chip on the distal of number 14. Well, patients, yeah, all they hear is, it's not important because it's maybe, it's little, it's this and that, and they don't understand what the distal buccal of 14 is. And on the flip side, I hear what you're saying. You need me to back you up when I walk in the room so you haven't wasted 45 minutes of your time.
Right. I mean, why are we watching things? Why are we saying maybe? Why are we not certain? We are professionals and we have an education and we have a license. We should all really be in that supportive environment to say, hey, I took a picture of number 3. Patient, you know, I don't know, let's just say Carrie and I were looking at this, and on Carrie's, you know, her molar, I showed her this, and I just want you to see what we've seen, and I mean, I don't know, I know I can't diagnose, but whatever terminology you and I agree from that, take it home.
Absolutely.
Maybe the last point to say would be for a supportive environment and going on to the behavior styles is once you get them scheduled, or even if you don't, follow up with what you recommended. How cool would that be? You could follow up with a text. I mean, gosh, all those different softwares that we have, we can create something to send it to their email or just encourage them to say, you know, hey, you've invested in your smile. If we have a product or a service, let's just say if it's for bruxism or what if it is for whatever, you know, if it's for a crown, you name it, an implant, have some information on that and then, you know, kind of nurture your patient with that so they know they're not alone.
That's a great point. You're not alone, for sure.
Yeah. It's not about us.
It's not about us, but it's about this guy, right? He's in some trouble.
We all probably feel like we're in that space.
I may have been there once.
That's exactly it. Well, I know that there are definitely 4 critical areas, and for those of you who are on this call right now, we have developed a virtual coaching program, and the 4 critical areas that we find are the most challenging are time management, product integration, closing the case or case presentation, and finally is marketing. And no one wants to hear about it, but it is true. Through social media and video blogging or just, you know, getting your fan page up and running. So in saying that, we do have an offer for you, and the offer will last until Saturday. So this is how it's going to go down. Those 4 critical areas, 1 hour a week. They're going to be on Fridays. This is going to be live. It'll be recorded, so if you're working, no worries. The other good thing is it'll be transcribed. You can download it also for 4 weeks. So it's an hour per week for 4 weeks. Then following that, you get access to David and I for 3 months. So it's a total of 4 months virtual coaching. We like the tag team concept. We're encouraging the team. And for the team, it's $850. Yes, 850. If you do sign up and register before Saturday, we're going to get it to you for $750. So we just have a link there for you for that. And give that some thought because these are areas we definitely look into. They're customized for you, and you can ask any question 24 hours a day, and we will get back to you. Any products that we do happen to mention, or if we're talking about crowns or anything like that, we get that information to you also because you're not alone. It's about the patient. At the end of the day, it's about making a difference for them and for us.
Absolutely. And you know what, Anastasia, I'll just add to that. You know, statistically speaking, the average dental practice earns less than $750,000 a year. And on top of that, and quite honestly, put the business aside, the average dental practice is full of team members who just aren't quite satisfied with what they're doing in life. So the question I had to ask myself years ago when I was the leader and stood in front of my team was the same question I'd ask everybody tonight is, you know, where are you right now? And what would you do if you could eliminate the elephant in the room? What would you do if you could be less stressed, if you could be more productive, and you could be in that top 10% of practices across the country? And if it's something you'd like to do something about, you want to know more about it, we'd be happy to help you.
I agree with that. It begins with the conversation and knowing what is expected. And I think, too, in looking at that from the patient side of you, it may be an answer to lead you as to, am I in the right place? Or may I best serve elsewhere? And that's really part of being a leader.
Absolutely. Absolutely. Well, I thank you guys for your time tonight. I apologize for, on behalf of Anastasia and I, for the fun WebEx beginning, but we got it done. Thanks for hanging in there with us, and thanks for Mario for straightening it all out.
Definitely, definitely. And before we do close, Mark, I want to thank you for that ending quote there, and we will close on that. There's a saying that people, or meaning patients, don't care how much you know until they know how much you care. Excellent statement. And we thank you all for caring and attending tonight, and we hope to see you soon.
Yep,
thank
cheers,
you.
Everybody.
Bye-bye.
Thanks, guys.
Thanks, guys.